Today we're going to talk about peripheral vascular disease. And when we think about peripheral vascular disease, we're going to think about our peripheral blood vessels. So we're thinking our arms, our legs. We're not thinking about our heart or our brain. So we're thinking about our peripheral blood vessels, and we understand our blood vessels can be our veins or our arteries, even our capillaries, but we're going to focus on veins and arteries today, and then disease. So we are going to think a narrowing of our veins and arteries. It can be caused by multiple things. It can be caused by plaque buildup, atherosclerosis. It can be caused by a spasm. But we just need to think that we have a narrowing of our blood vessels, either our vein or our artery, that has now affected the perfusion of our tissues, okay? I'm a very visual learner, and we are specifically going to focus on our venous diseases and our arterial diseases, okay? In terms of medications or surgical intervention, you all will need to read and look up on those. We are today going to talk about specific manifestations, and we're going to talk about specific nursing interventions we need to implement to provide safe care for our patients. So, on each side, we're going to differentiate between the manifestations of a venous disorder and arterial disorder. In the middle of my big heart are going to be interventions that are universal for both disorders, okay? So we know how to group them together, and then we're going to talk about positioning towards the end, okay? So what I want you to look at is my picture. This is our heart, and we know our arteries take oxygenated blood to our heart to perfuse our tissues. And we know our veins take our deoxygenated blood once our tissues have used our oxygen and take our deoxygenated blood back to our heart. So what you need to think about, what really helps me remember my manifestations, is how is the blood flow affected, okay? You see with this picture, we're talking about our arteries. So the obstruction, let's say that's plaque that's built up in our artery. We need to think the obstruction is in our artery. So our blood flow is coming from our heart, and this is a picture of my foot. I'm not the best drawer by any means, but our foot or our hands, wherever that obstruction is, our blood is coming from our heart, but is not getting to that extremity. But there's nothing wrong with the venous system. Our blood can still go from our extremity back to our heart. So on the arterial side, you need to think, my blood is not getting to that extremity how I would like it to get. So what manifestations are going to present? On the opposite side, again, this is my foot, there's no problem with your blood getting to that extremity. For instance, this is again a foot or the arm, wherever that obstruction can be. We could have a venous disorder in our arm as well. But we're thinking the blood flow is getting fine to that extremity. However, we cannot take our blood from our extremity back to our heart. So we're going to start having a buildup of blood in our extremity. So I really like to think about how the blood flow and what manifestations present from that. So let's talk about pain first. With arterial disorders, all this blood is trying to go from our heart to our foot, but cannot get there effectively. So arterial disorders have a very specific type of pain called intermittent claudication. And they also have rest pain. So let's talk about this. Intermittent claudication. We know the blood cannot get effectively from the heart to our foot. So this client is walking, and with activity, this blood starts pumping faster, and it just starts pooling in that extremity. So intermittent claudication is a very sharp calf pain with activity, okay? And then they could have rest pain. So when these clients are lying, for instance, in bed at night, they are sleeping, their extremity is elevated. Well, they already have decreased perfusion to our foot. If we are elevating that extremity, their perfusion gets even worse. So in the middle of the night, they can wake up with this sharp pain called rest pain because of the positioning of the extremity. Let's talk about pulses. So on this side, we have difficulty of blood getting to our foot. So with arterial disorders, they could have an absent pulse, they could have a weak pulse, they can have an unequal pulse. Let's say this is the right leg and there's an obstruction, but the left leg is fine. So when you always check pulses bilaterally, this one could be weak versus this one is normal, +2 +3. So just think, we have trouble getting the blood to our foot. So we can have a weak, I'm going to say absent, or unequal pulse. Let's talk about edema. Will this client have edema? They have difficulty getting that blood to the foot. Is it going to pool and sit there? No, because the problem is perfusing that extremity. So these clients typically do not have edema. Okay? Let's talk about temperature. Again, the blood is trying to get to our extremity, but is not getting there effectively because of occlusion in the artery. And we know the arteries take blood from our heart to our extremities. So what will this client's feet feel like when we touch them? And again, my example is just the foot. It can be the hand. Wherever the obstruction is, it'll be cold. It'll be cool because we are having trouble perfusing the extremity. So they can have cool extremities. And the color, again, we need to think there's a lack of blood flow to our extremity. So the color can be bluish. It can be gray, okay? And they have something called elevated pallor because they have difficulty getting the blood to their foot. When they elevate their extremity, well, we know by gravity the blood is not getting there effectively. We are not helping because we're not dangling that leg. So it's called elevated pallor. The extremity can go very pale because there's already a circulation impairment to that leg or extremity, and we're elevating it, so it's making it even worse. It's exacerbating the problem. So they can have elevated pallor or dependent rubor. Let's say we hang that extremity down. Well, by gravity, it's helping the blood flow to the foot, but remember there's an obstruction. So the blood can start pooling in a certain area, causing it to get reddened, okay? So they have something called elevated pallor and dependent rubor. And in terms of wounds, we again have to think, the problem with the arterial disorder is the blood cannot get to the extremity. So they are at a very high risk for ischemia or necrosis or gangrenous wounds because the blood is not getting, oxygenated blood is not perfusing this extremity. And typically where you see the wounds, they're typically regularly shaped. They don't have irregular borders. They're typically pretty smooth in appearance. And they more so manifest in the toes, the heels, in any areas of pressure. So we're going to say regular in shape, and you're going to think toes, heels, and pressure points. I put a little star here because there's something very specific to arterial disorders that doesn't pertain to venous. With arterial disorders, you're going to think that there is going to be a change in blood pressure measurements. So I'm going to put change in BP measurements. So typically, if we have to, for instance, let's say we had a double radical mastectomy client and we couldn't get a blood pressure in the upper extremities. Typically, when you take a blood pressure in the lower extremities, it's always higher than the upper extremities. Well, we have a disorder that is impairing blood flow to our lower extremities if they, for instance, had an occlusion in their leg. So with arterial disorders, you typically see blood pressure measurements lower in the bilateral lower extremities versus the upper extremities. So I'm just going to say BP measurements lower, okay? In your lower extremities, because typically it is normal, like I said, if you take a blood pressure measurement in your lower extremities, it's typically higher than your upper extremities. But if we have arterial disorder, and let's say there was a clot or an obstruction or a decreased perfusion in my left leg, and I took my blood pressure here, it would be lower than my upper extremity. If this was a healthy leg, it is very typical or normal for your blood pressure measurement to be elevated in your lower extremities versus your upper extremities. And something else you need to think about, we are not oxygenating or taking oxygen-rich blood from our heart to our lower extremities effectively, and without oxygen, without those nutrients that blood carries, we need to think about hair growth. We need to think about toenails. With arterial disorders, they typically have no or poor hair growth, dry skin, and thickened toenails. And again, how I remember that is we are not taking that oxygen, nutrient-rich blood from our heart to our extremities, so we cannot grow hair. Our toenails start to change, become brittle or thickened, and then we have dry skin, okay? Let's pop to the opposite side. With our venous disorders, we have no trouble taking oxygenated blood from our heart to our, for instance, and again, this example is my feet, to my feet. However, the problem comes taking the blood from the foot back to the heart. This is where obstruction is. So you can just picture a pooling of blood sitting in an extremity for long periods of time. However, it helps you remember this. So let's talk about pain. They do not have intermittent claudication. With activity, they don't have a sharp pain because the blood's not pooling right here. They have a dull, constant, achy pain, okay? Because no problem perfusing the foot, the problem is getting that blood back to the heart. So blood kind of just pools, especially in those extremities. So we're gonna think a dull, achy, and I'm gonna say constant pain. Let's talk about our pulse. We have no problems getting blood from our heart to our foot with venous disorders. Again, it is getting the blood back to the heart. So these clients will absolutely have a pulse. You might not be able to feel it because we're going to talk about edema next. These clients can have very severe edema, so you might not be able to palpate the pulse through the edema because they have so much swelling. But if you get a Doppler, it will absolutely show you that they have effective blood flow because the obstruction is not in the artery, it's in the vein. So they have positive pulses. Like I said, it might be hard to palpate through the edema because they definitely have edema because, again, the foot is getting oxygenated blood. Now the blood can't get back to the heart, so it's all going to pool. We're just going to be congested with our blood flow right here. So positive edema. In terms of temperature, and when you look at specific venous disorders like DVT, deep vein thrombosis, phlebitis, thrombophlebitis, all those things, you'll notice they can have a warmed, reddened symptom, and think blood's getting to the extremity just fine, it just can't get back to the heart. So all that blood's just pooling right there. So typically these clients are warm when you touch them. Color, because of that chronic pooling of blood, they don't have changes, on the arterial side, they're not getting oxygen to their tissues. So they're bluish gray, or they have a change in color depending on the position. Well, we're gonna think all this blood is just pooling and sitting right here. And they have, if they have a coloring disorder, it's called stasis dermatitis. And this is pretty much a browning discoloration, okay? And it's typically at the lower leg, ankle area, with that blood just pooling and sitting there. And then wounds. With venous disorders are not as high risk of ischemia or necrosis or gangrene like your arterial disorders because they're not getting oxygen to that foot. But they typically present in irregular borders or shape. And the most common sites is the lower legs and ankles for these disorders. So I'm gonna say lower leg and ankles. So when I think about these disorders, I really think about the blood flow and what manifestations present. Now we're gonna talk about specific nursing interventions. Like I said, you need to review medications, you need to review any surgical interventions like an endarterectomy or a bypass to get around obstructions. We're gonna talk about specific nursing interventions that we need to do for these clients, okay? So in the middle, this is gonna be universal for both disorders. Our circulation is compromised, so we absolutely have to do peripheral vascular assessment. So vascular assessment, I like to think about the 5 P's. Pulse. Do they have a pulse? Paresthesias. Do they have any numbness, tingling? That can be evidenced by impaired blood flow. Pallor is a P, but what you need to think about is color. What does their extremity look like? Is it blue-gray? Is it brownish in discoloration? So pulse, paresthesias, pallor, or think color. Paralysis, can they move the extremity? Okay? We always need to think about movement, because if they have decreased blood flow, we could be affecting their ability to mobilize that extremity. So pulse, paresthesias, pallor, paralysis, and the last P, can't think of. Give me 1 second. I always write my notes down. Pain. Can't believe I forgot pain. So, pain. Again, very, very different in the type of pains, okay? So I'm going to write pain, pulse, pallor, and again with pallor, think color. Paresthesia. Do they have any numbness, tingling related to a decreased blood flow? And paralysis. Is their movement affected? Again, related to if they have impaired blood flow. So always do your peripheral vascular assessment. Next, we need to always think about safety, okay? So with these clients, they already have impaired circulation. We need to ensure that they are not doing other things that could affect or further impair that circulation. So they need to make sure that they're not crossing their legs, because crossing the legs can inhibit blood flow. We need to make sure that they are not wearing constrictive clothing. We need to avoid extremes in temperature related to safety. They have impaired blood flow. That means they could have impaired sensation. So we need to ensure, and I'm just going to say avoid extremes in temperature. For instance, if they have leg pain and they're using a heating pad, if their circulation is impaired, can they feel when that heating pad is getting too hot? Can they feel if their skin is being burned? That's a safety implication. What about on the opposite end, extremes of cold? They go out and it's snowing outside. Well, we know cold vasoconstricts our blood vessels, which even further impairs blood flow. So they need to think about extremes in temperature. They again have impaired blood flow. Their sensation could be affected. They really need to make sure that they wear safe, sturdy shoes, because they need to protect their feet and lower extremities from injury. We need to make sure that they are doing a skin assessment. We need to have our clients looking at their feet daily. We need to make sure, first off, they didn't cut or hurt their foot and they didn't know it. We need to protect their feet because of a lack of sensation. We need to assess any wounds. So along with that skin assessment, if they need to be educated on wound care, educate them appropriately depending if they have a wound or not, or what treatment we are giving to them. So this is universal for both disorders. We need to ensure we're doing a peripheral vascular assessment. We need to make sure we're maintaining their safety. They're assessing their skin and providing adequate wound care. And I put positioning separately. So we really need to think where the obstruction of the blood flow is, because that determines what is the best position for our client. So let's talk about the arterial side. The blood flow is obstructed. We cannot get our blood to our foot, okay? So when we think about positioning, do we want that foot elevated above the heart? No, because the blood is flowing back to the heart. The problem is getting the blood to that extremity. So we like clients with arterial disease to keep their extremities or the affected extremity in a dependent position. So gravity can help assist the blood flow to that impaired extremity. Yes, if they have edema, they might need to elevate it, but we never recommending, and I'm going to put don't elevate above heart. We never, with arterial disorders, want to elevate above the heart because, again, the blood, when we do that, blood is rushing from the extremity back to the heart. But the problem is not getting the blood back to the heart. The problem is getting the blood to that extremity. So make sure in terms of positioning for your arterial disorders, we keep it in a dependent position and ensure that you never elevate it above the heart. On the venous side, our obstruction, we have no problem getting the blood to that extremity. And again, I'm pretending this is my foot. The blood is going fine from the heart to the extremity. The problem is getting the blood back from our extremity to our heart. So with these clients, elevating above the heart is effective. By gravity, we're helping to get the blood to flow back to the heart. So we like to elevate. And not only elevate, we can elevate above heart, okay? Let's think about devices we have to assist to prevent in venous pooling. What about your TEDs? What about your SCDs, your sequential compression devices? Both of these things provide pressure, provide compression. For instance, we put those really tight TEDs hose on. Well, it compresses our veins to push blood back to the heart. So for this side, we like TEDs, okay? We like SCDs. They are beneficial to prevent pooling of blood and to help recirculate that blood back to the heart. So this is how I like to remember PVD versus PAD. I'm a very visual person. I hope this helps. Thank you.